As we get older, managing our own healthcare needs can be overwhelming. Things like keeping track of doctor appointments, multiple prescriptions, and making the home safe can become an enormous undertaking without help from others. As an alternative to nursing facilities and expensive hospital care, many are turning to in-home healthcare services. In 2008, the U.S. Bureau of Labor Statistics reported that the number of home care aides increased by 138% between 1992 and 2005, amounting to almost 1 million employees, indicating that many Americans want to have the care they need in the most comfortable place possible, home.
And I didn't know much about home health except, I knew that they told me at the hospital that I would have to have home health to come dress this wound every day. And they've been coming every day since then, and I was just looking for somebody that could help me take care of my problem.
Home healthcare nurses take an active role in coordinating the patient's needs and teaching patients how to manage their disease. They also play a vital role in managing complicated medication regimens, an important issue facing many patients and their families.
Occasionally, a patient may become over-medicated, and I think that it may be due to just a lack of communication. The patient may fail to let the nurse know that she received a new medication, or let the doctor know, or let the pharmacy know that, hey, I'm taking this pain medication. Is this medication, pain medication, if it were to be the case, going to be okay with it? Or this sleeping medication that I'm taking, is that going to interfere with one of my pain medications? They may not always think to ask those questions to their nurse or to their doctor or to the pharmacist. So that's where we come in. We try to help prevent any miscommunication among the patient and the physician, especially when they use multiple physicians.
I just didn't really understand or realize what all they did. It's very much of a service to any community to have a good home health, or to anybody that needs it. It does keep people out of the hospital, I think, because they have nursing care right in their homes. And I just think it's a great industry.
For many, home health care has proven to be an invaluable benefit. Services can range from help with daily tasks like grooming to highly skilled nursing procedures like IV therapy or wound care. Physical and occupational therapy are also valuable services that improve patients' independence and prevent injuries from falls, one of the leading causes of nursing facility placement in the U.S.
Before they came, I had fallen a total of 6 times. And since they treated me, I haven't fallen any. Falling is a big deal for me because of hip replacements. I have trouble getting up. I can't get up on my own. I do not have to go to a nursing home. I really appreciate that part of it.
We, of course, do a head-to-toe assessment, a physical assessment of the patient, and we assess their medications as well. We assess their home, their living environment for safety issues, safety hazards, any psychosocial issues that they may have about how they're going to obtain their medications, how they're going to do any of their personal care as far as bathing or any of their household chores. It's just an overall view of the patients, not just their health, but their environment also that they're in. And then from that, we formulate our plan of care.
Cooper Home Health has been caring for the people of Northeast Texas since 1993. Serving 18 counties, the compassionate staff of almost 400 provides skilled nursing, physical, occupational, and speech therapy, personal care, and community-based programs.
Generally, skilled home health is a program that we think of as being provided through the Medicare program for Medicare beneficiaries. It can also be an insurance patient that might qualify for skilled home health. Generally, that includes things like skilled nursing care, physical therapy, occupational therapy, speech therapy, home health aid services, and those skilled programs can include some pretty high-tech types of services like IV therapy, wound care, wound vac, diabetic teaching. The primary home care program is a program where patients get personal care assistance in their home. Things like bathing, dressing, grooming, shopping, The Community-Based Alternatives Program in Texas is a nursing home waiver program. It was originally designed to keep patients out of the nursing home. In the Community-Based Alternatives Program, patients can qualify for personal care services at home, in addition to other things that would make their home safe so that they can stay at home rather than going to a nursing facility. Things like minor home modifications that would include building a handicap shower or wheelchair ramp. It's less expensive to take care of patients at home than it is in a nursing facility. So we provide those services as an alternative to the nursing facility placement.
This one moves a little better than the other one.
Home care gives patients a choice and allows them to stay in the comfort of their own home, where studies show they will actually heal faster. How can you choose the agency that is right for you? One tool is Home Health Compare on Medicare.gov. Cooper Home Health ranks high on this website that compares home health agencies' performance. By helping patients reach their goals and avoid costly hospitalization or nursing facility placement, Cooper Home Health remains a leader in the home care industry.
I think our work ethic and sort of our informal motto is we always do what's right by the patient. That is really important to me as an owner of this company, that we do what's right. Our staff work well together. We often have patients that are on more than one program at a time, and we make sure that we coordinate between the nurses and the doctors, make sure that they're getting the care that they need. We're from this community. We live here, and we care about our neighbors and our family members and our friends, and that's probably how we get most of our patients, is through word of mouth.
I don't know what I would have done if somebody hadn't come every day and dressed that leg. I don't know what happened when they didn't have home health and this happened. I guess you would have had to stay in the hospital for months and months, you know, if it hadn't been for home health, and in my case, Cooper Home Health.
All the nurses, they really knocked themselves out trying to do a good job, and I'm thankful for them.
To learn more, visit cooperhh.com or call 866-395-5857 for a free evaluation.